just talking with all the four of us right here and your different births, right? Variations of normal and what is a myth versus a fact is not always crystal clear.
We are starting off season 2 reacting to a Reacts video. There are some OBGYNs, high-risk OBGYNs, who have reacted to common childbirth myths.
I know people see it in the TV and movies, and it's a very dramatic event, and it's clear cut, and you rush to the hospital, the baby is born. That's not always how it happens. Sometimes it does break with a huge gush, and it's very obvious. Sometimes there's a leak, and patients are unsure. Sometimes we will break your water for you. For some patients, they will be in labor and progressing nicely in labor, and the water will not have broken on its own.
If you're unsure whether or not your water is broken, it's better to come in and let us tell you yes or no, rather than stay at home. Because if your water has broken and there's a long time before your delivery, you do increase the risk for getting an infection.
Fine, whatever.
But why do they have to break your water if
They don't. See the video that we posted on social media today. Here's a funny statistic. The medical textbooks say that the chance of your baby being born in the cull is 1 in 80,000. 1 in 80,000. I have had 4 end-cull births in the last 12 months. How about you, Layla?
Yeah, totally. Like at least once a month.
Yeah, it's not, that's not true. That statistic is only true if they have a standard policy to rupture your bag at 5 centimeters if they haven't already. This myth is correct in that you don't always know that your water breaks. There's really sometimes no warning, and it is sometimes hard to tell. The only takeaway I would give with this is that if your water breaks like that silly video with a kersplash on aisle 4, you know, clean up in the supermarket, drop your pickles.
Which does sometimes happen. It does.
Then my recommendation to my clients is always that you lay down horizontal immediately wherever you are and call your midwife so that we can risk assess for cord prolapse. Because the only real risk with rupture of membranes before your delivery is a cord prolapse, where the cord slips in front of the baby's head and is washed out with the water rapidly leaving. Then every contraction after that would compress that hard baby's head onto the hard maternal pelvis, squishing the baby's oxygen supply through the cord, the actual thing we're all worried about. It is so incredibly rare. It's so unlikely. It's more likely for babies who are malpositioned. So if you know you're walking around with a baby who's breech or transverse, or it's more likely with multips having their 5th, 6th, 10th, 12th baby, because they just tend to have a lot of room and a baby that doesn't settle into the pelvis. Very, very unlikely for primates. Very unlikely for a first-time baby. But that's really the only risk. You don't need to rush to the hospital. You don't need to freak out. And then we do like to have a baby in a normal time frame. You do increase the risk of infection the longer it's ruptured. But statistically, that risk increases after 24 hours. And the new ACOG guidelines, have you seen them? The new ACOG guidelines do not have a time limit.
Really?
Whoop, whoop. Seriously.
Huh.
I read them last week. Layla's not
interested
convinced.
how that will change Florida laws or
Probably
not Florida laws.
not
State laws.
Yeah.
I'm interested in how that will change state laws for midwifery scopes of practice.
I imagine that 20 years from now, we will finally match that new evidence.
There's that evidence practice gap right there. Yeah.
Yeah, evidence practice gap. But anyway, I have routinely allowed patient determination of everything, you know, patient choice, sovereign authority over bodies, and not had any time limits in my practice over 25 years. And almost all labors start within 3 days. Most start within 2 days. A large majority start within 24 hours without any intervention. But I've stayed pregnant monitoring folks for 7 days, 14 days, 5 weeks is as long as I've supported someone with their waters released.
Mine was broken for 4 days again, because we were in that situation where it was a bigger risk to have baby come than it was for infection. So they were like, okay, we'll
Interesting.
see. They admitted me and they said, we'll just keep you here until you have a baby. We'll see. And I did, like serial ultrasounds to monitor fluid levels,
NSTs,
like that, to
all
make
those-
sure
yeah.
that everybody was good. But I think it was 4 days before they were like,
And this was like a preemie
Go ahead.
baby too, right?
31 weeks.
That's so interesting that 1 minute we've got like a 40-week full-term healthy birthing person, and we're like sectioning it 24 hours, and you've got a 4-day preemie, and they're like, we're just gonna wait and see. That's
Yep.
so like obviously hypocritical. Becca, your waters broke right before birth?
Yeah, both times they've broken when I'm pushing. They don't break until I push, which is always
And
fun.
Augustine, what about you?
My first broke as her head was born.
Uh-huh.
My second broke somewhere around 8 centimeters, I think. I'm not really sure. And my last started with my water breaking. And like 18 hours or something, I had a baby, which was my fastest labor.
My first, they broke my water because they wanted to do an internal monitor because he was not moving as much as they would like him to. 2 years later, I remembered that I had taken Tylenol PM to try to sleep. And that may have had something to do with his activity level, but yeah.
But moving isn't a determiner of health for OBs, only for moms. That doesn't make sense to me.
That's my memory of it. So we'll say that. That was my memory.
Isn't that interesting how our
remember the
memories
monitor?
change?
Was he okay on the monitor? Do you remember that?
Fine. They broke my water to put the internal monitor and walked out, and I said I had to push. I went in at 7. They did that after, I don't know, they probably did like a 20-minute strip, I'm assuming. And then
He just wasn't having XLs. Like he wasn't like, he wasn't awake. He was
like,
just sleeping.
I got to the hospital at 1 a.m. and he was born at 2:54.
Wow.
Yeah.
Go baby, go.
Both of mine broke with waters first. I mean, waters, nothing, waters, and then 12 hours later, contractions starting, or et cetera.
That's
so,
normal.
Yeah, it's so interesting. Everyone's different. And I think that especially, and that is like just talking with all the 4 of us right here and your different births, right? Variations of normal. And what is a myth versus a fact is not always crystal clear. So we thank these high-risk MFMs for giving us their knowledge and wisdom today.
And opinion.
And opinions, yeah.
And opinions.
If your water breaks, that means the baby is coming very soon. If only.
Yeah, we wish. This is not always the case. It is all over the map.
Because a lot depends on how many children you've had. If it's your 4th baby and you're contracting and your water breaks, it's coming fast. If it's your first baby, your water breaks, you're not contracting, it could be 12, 24 hours. So it's hard to know. Contractions that come consistently with the baby's head against the cervix are what makes the cervix open. The cervix has to get to 10 centimeters before you can push. So that process is the process of labor. If your water breaks in the course of that process, great, but that doesn't tell us the timing.
For some subset of our patients, the water will break and the patient may not be in labor. That happens in probably 8 to 10% of patients.
So if you think your water is broken, you should call your provider and say, my water's broken. I am contracting or not contracting. And when should I come in? Because that answer is going to vary depending on the circumstances around your pregnancy.
What was the water flooding out of the dam visual supposed to be?
Okay, I have to say, I'm interested to like skip to the end and see who the producer, because I see it's made by Business Insider. So I think that men have produced this video.
Oh.
You might be
And
onto
that is
something there,
what they
Layla.
imagine.
That
That
Okay,
spontaneous
so
rupture
literal
of membranes.
Oh my God.
I have a friend who, when she was pregnant, she was always afraid that her water would break in public. So she carried around a jar of pickles so that if her water broke, she could just drop it
Throw it.
to cover it up.
Because broken glass is a lot more
better
important.
than hey, that's a good
Then, but like that, like, let's talk about that though. Like, that's a whole nother level of like shame and embarrassment around a natural process.
Yeah.
Well, welcome to the patriarchy. Like, when have we, like, hello, this is
Exactly
so true.